everyone, and welcome to Just Thoughts. Today, we discuss a serious pandemic that poses an equal threat to that of COVID-19. Cholera is a severe acute diarrheal illness caused primarily by the bacterium Vibrio cholerae. It is a highly contagious waterborne disease that poses a significant risk in areas plagued by unsanitary conditions where access to clean water and adequate health care is severely restricted. This infectious disease has a long and troubling history, with roots extending back to ancient civilizations and a significant impact recorded during the 19th century. The first cholera pandemic began in the early 1800s, originating in the Indian subcontinent, before sweeping across Europe, Africa, and the Americas. Later, the 1854 outbreak in London's Soho district, famously investigated by Dr. John Snow, led to groundbreaking public health advancements, shaping modern epidemiology towards clean water and sanitation. Cholera spreads mainly through the consumption of contaminated water or food, particularly in areas where sanitation is poor. The disease is often linked to crowded conditions and limited access to proper hygiene facilities, making it a major concern in regions experiencing conflict, natural disasters, or economic hardships. With an estimated 1.3 to 4.0 million cases and 21,000 to 143,000 deaths occurring annually, cholera remains a grave public health issue worldwide, accentuating the vital need for effective interventions. Currently, cholera is wreaking havoc in war-torn Sudan, where the humanitarian crisis has escalated alarmingly. Over the past 2 months alone, reports indicate that at least 388 lives have been claimed by this devastating disease, with approximately 13,000 others suffering from its effects. The outbreak is primarily the result of heavy rainfall that has contaminated drinking water sources, creating a fertile ground for the spread of cholera. Disturbingly,
if you've
this
ever
marks
asked
the
the question,
second
how
cholera
could things
outbreak
get
in
worse,
Sudan following the
Sudan
onset
is
of
an answer.
conflict
Life in
16
Sudan
months
right now and in
ago,
Darfur in particular
reinforcing the
is
severe health threat
probably the
faced by
closest thing
displaced
to hell one
communities
can
throughout the
imagine.
region.
Heavy rains ruptured a dam in Arbat on Sunday, sweeping at least 30 people away. A cholera outbreak
The
has
Federal
now
Ministry
infected
of
more than
Health in Sudan
650
took a
people,
decisive step by officially declaring a cholera
and
outbreak
a civil
on
war
August
still
12,
rages.
We have
2024,
impending crisis
in light of the
around
alarming
famine.
surge in
We are
cases.
not getting medical supplies in where there are health crises. But more importantly, we have to remember the suffering of the people.
Health
The United
authorities and the
Nations'
government
second
are
highest ranking
mobilizing
official,
resources
speaking of the
and
roughly
strategies to
26
contain the
million
outbreak,
people who need
providing
aid.
crucial
Reuters
medical
now
assistance
reporting the
to
World Food
those who are
Program
affected.
is investigating 2 employees, one for 200,000 liters of fuel going missing, and another for allegedly concealing how the army, a faction in the Civil War, prevents aid from reaching areas controlled by its enemy.
You're looking at a situation where there's been
Apart from Sudan, cholera is also spread in several countries facing challenges related to sanitation, access to clean water, and health infrastructure. Regions such as Afghanistan, Yemen, Pakistan, Ethiopia, and Haiti have experienced significant outbreaks in recent years, exacerbated by conflict, natural disasters, and economic instability. These conditions create an environment conducive to the spread of cholera, particularly in densely populated areas or among displaced populations. Additionally, Cholera has been reported in countries like Bangladesh, the Democratic Republic of the Congo, and some parts of Latin America, highlighting the global nature of this disease. Efforts to address cholera outbreaks in these regions emphasize the need for improved water treatment systems, sanitation, and public health education. Defeating cholera involves prompt treatment, primarily through rehydration therapies to address severe dehydration. Oral rehydration therapy, ORT, can be life-saving, particularly for those with mild to moderate symptoms, while intravenous fluids may be necessary for severe cases. However, immediate treatment is just one component of a comprehensive strategy to combat the disease. To effectively prevent cholera, it's crucial to improve access to safe drinking water and sanitation facilities while promoting hygiene practices. Vaccination through oral cholera vaccines, OCVs, also plays an essential role in bolstering community immunity, particularly in outbreak-prone regions. Enhanced surveillance for early detection, community education, and long-term investments in water and sanitation infrastructure are all integral to establishing lasting solutions. By fostering a collaborative approach among governments, health organizations, and communities, we can work towards eradicating cholera and ensuring that future generations are safeguarded from its deadly effects. The fight against cholera cannot be fought in isolation. It requires a concerted effort to not only treat those currently afflicted, but also to put preventative measures in place, ensuring that communities can access the resources necessary to protect themselves from this deadly disease.